Hello, my name is Jessica Moore, and thank you for coming to my presentation on bad parenting practices and what we can do to resolve them. Now, I'm going to start with some questions. So, raise your hand if you would say that you had good parents growing up. Okay, and then raise your hand if you would say that you had bad parents growing up. Okay, and then for my last question, raise your hand if you would say that you experienced some form of neglect as a child. Yeah, that's a tricky question to answer. But according to a study by JAMA Pediatrics, 80% of kids have experienced some form of neglect. Of these kids, 81% were maltreated by a parent, 18% experienced physical abuse, and 9% experienced sexual abuse. To add to this, 25% of first reports come in before the age of 2, and 6% of all children have experienced abuse by the age of 5. Bad parenting is one of the biggest problems this country faces, as generation after generation faces issues because of bad parenting practices that are passed down. These centuries of parenting failures can be resolved by promoting safe sex and healthy parenting education, providing support to new parents, and making mental health care a priority. There was a 5-year-old girl. One day, she was in the kitchen and was trying to help her mom unload the dishwasher. Now, some of the cups were plastic and were safe for kids to use, but some were glass. The little girl picked up one of the glass cups, but it was too big for her and it slipped out of her hands. The cup fell and shattered all over the floor. The mom immediately started screaming at her, and the dad took her up to her room, spanked her, and grounded her without dinner. Now fast forward to 15 years later, and this girl is now 20 years old. She cannot move on from any small mistake she makes unless she physically hurts and punishes herself. This parenting practice that has been used for hundreds of years has caused this girl incredible trauma that will take a lifetime to undo. And she isn't alone. So many people have experienced this trauma and inability to make mistakes and resort to self-harm to solve the problem. Spanking is a practice that has been around for hundreds of years, and the problems it causes are only just now coming to the surface. What this presents is an issue that urgently needs to be solved. So what can be done? First of all, we can start at the root of the issue. We can start with the teens. It is so important to educate all teens on safe sex and effective parenting practices. The U.S. has the highest teen pregnancy rates of all industrialized countries. While some teen parents can rise to the challenge of childbirth, the majority just cannot handle the pressure of being parents. A healthy teen also performs better in school, and with safe sex practices, they will be able to do better and be better set up for life to one day support a family. According to a study done on sexual health education and academic success, evidence-based health education reduces sexual risk behavior by delaying sexual initiation, reducing pregnancy and STIs, and increasing contraception. This shows just how important educating our young is versus shielding them from proper knowledge and trying to protect them from a truth that some adults just cannot handle. The next factor that can contribute to better parenting practices is beginning to implement gentle parenting. Now, the term gentle parenting is often looked down upon because generally people assume that gentle parenting equals permissive parenting. The stigma is that gentle parents get walked all over and produce bratty kids. But when done effectively, families work together to teach children how to express their feelings and become happy, confident, and independent. This is all about creating a secure attachment with your child and making them feel heard and that the parents can be trusted. The Minnesota longitudinal study of risk and adaptation showed that the quality of attachment in the early years greatly affects late childhood, adolescence, and adulthood. Their most important finding was that secure attachments early on with parents leads to greater independence later on in life. The opposite being that insecure attachments lead to very dependent people. According to this study, children with secure attachments will most likely develop higher self-esteem, better coping mechanisms, positive romantic relationships, and greater social confidence, just to name a few things. This just goes to show how effective gentle parenting and creating secure attachments can truly allow children to flourish. Another way this problem can be solved is by providing parents with an abundant amount of resources. Many bad parenting habits develop in the beginning and are extremely difficult to break as the child continues to grow up. There are so many cases of mothers who develop postpartum anxiety and depression and have no proper way to deal with it, so these issues end up being taken out on their children, causing irreversible damage. Doulas are something that have been proven tremendously helpful in the birthing and early parenting process. According to a study done by the Journal of Perinatal Education, doula-assisted mothers were 4 times less likely to have a baby with a low birth weight. They are also 2 times less likely to experience a birthing complication. And they were significantly more likely to be able to breastfeed. These are all things that, when they happen, can cause mothers severe emotional distress and the inability to parent properly, which makes having a doula a great option to prevent these concerns from ever happening in the first place. What is also extremely important is helping mothers with postpartum depression, which so many struggle with but don't even realize it. Postpartum depression can be very unpredictable, and it's hard to tell who will be affected by it or not. According to Harvard Health, the strongest predictor of a mother being susceptible to depression is a previous history of a mood disorder, especially if it is currently present and untreated during the pregnancy. Women with a history of depression are 7 times more likely to experience significant postpartum depression, which makes this something that is so important to catch early on so the child is not affected by it. 2 doctors at Harvard Health, Dr. Stewart and Vivod, discussed how important it is to implement early treatment and support for women with even the mildest symptoms of postpartum depression. Their studies show that supportive and psychological care right after birth can decrease an at-risk woman's chance of developing significant postpartum depression. This care includes many home visits from nurses and doulas, telephone-based support, and interpersonal therapy. When these practices are implemented, we see mothers and family units who can function better and raise their child in a better environment. In conclusion, when all of these practices are put into play, we can solve the problem of bad parenting and childhood trauma. When we educate our children and adults on safe sex and the healthiest parenting practices, and providing as much support as possible to new mothers and parents, we aid the future generations by giving them their best chance at life. African-American abolitionist and author Frederick Douglass said, "It is easier to build strong children than to repair broken men." And I couldn't have said it better myself. When we build up our children and give them everything they need to succeed, they will. Bad parenting and poor education will never allow children to fully succeed when they are trying to fix what is broken because of their parents instead of focusing on becoming the best that they can be. We can make a difference, fix what the past has broken, and save our future generations by saving ourselves and being the best parents we can be. Thank you so much for listening to my speech.